Okay, we're continuing with this. My book here, it's called Prevent and Reverse Back Pain by me, Pete Rogers. We're on page 5. And the question is, why am I so confident about my theory of back pain? And I said it's because I've been doing this for many, many years, for decades. And I see many, many thousands of spine cases. And I see them in association with calcified abdominal aortas and all these other diseases with the patients having hypertension, diabetes. Okay. They all have the same diseases. It's kind of like a big joke, you know, a textbook with 1,000 diseases when all the patients have the same thing: hypertension, prediabetes, diabetes causing atherosclerosis. Okay, and then a lot of this other stuff: the atherosclerosis, autoimmune disease, congestive heart failure, atrial fib, etc. Okay, and then why does one diet cure so many things? Because it's the species-specific diets. You know, like Genesis 1:29, I put every plant on this earth to be food for you. Okay, that's why everything gets better when you eat it and everything gets worse when you don't eat it. Okay, who's another famous person who says the same thing? Dr. Gooby. So Dr. Gooby is the MIT neuroscientist guy a spine surgeon. He made a video about why I'm alone. Here it is. I was an MIT neurosurgeon. Now I'm unemployed and alone in the mountains. How did I get here? And I thought it was kind of funny. And that got 18 million views. Okay. And what Dr. Gooby noticed is that if he had to delay a case for a couple months, and the patient then, before they went to the OR, that patient would often get better if they ate a plant-based diet, they walked a lot, got some exercise, got out in the sun, quit smoking, avoided alcohol, managed their stress, got adequate sleep. So the point is that's a good thing to do. And their back pain would often diminish or go away. And the same thing had happened to me when I was in my 30s. I had terrible back pain, but I became vegetarian. It all went away. And then what's the metaphor from the ancient Greeks, like Theseus, when he got the thread here? I'll show you the painting from Ariadne to get out of the Minotaur's labyrinth. Okay, so here's Ariadne, you know, the Greek lady giving Theseus the ball of thread that he's going to use to escape out of the maze, the Minotaur's maze. Okay, what is the mechanism of ischemic spine failure? Like I was getting into, the outer part of the disc being the annulus fibrosis, like a steel-belted radial tire, circumferential, being injured by ischemia, then it cracks. And now the nucleus pulposus, which in the center is like a jelly donut, the gel can then leak through the crack, and that's a disc herniation, or it can simply dry out, desiccate the disc. And then when the disc is dried out, it loses height. That's a desiccated disc. Disc space narrowing. That's how it gets described on, you know, any type of film, plain film, CAT scan, or MRI. And then once the disc is no longer functioning correctly, you get a wobble between the vertebra above and below that abnormal disc, and that's called segmental instability. It's sensed by the spine's proprioceptors, which then respond to that by causing bone growth out of those vertebrae, so they'll fuse together. If they fuse in front or to the side, that's called DISH, diffuse idiopathic skeletal hyperosmosis. The bone spurs are called osteophytes. If they're real thin and narrow, you can also call them syndesmophyte. The bone will also sometimes grow straight through the disc, and that's called interbody fusion, fusion between the vertebral bodies. It'll grow along the posterior longitudinal ligament, which is behind the vertebral body, and that becomes OPLL, ossification of posterior. I'm going to show you a picture in a moment, but I kind of described it all real fast up front because I know that people could read that in the preview, and I wanted them to be able to read that if they were interested. Then I'm going to start going through the pictures and going through all the nuance of it, okay? When you get these bone spurs, these osteophytes, either into the foramen or posteriorly with OPLL or just disc osteophyte complex over the posterior end plates, they can compress nerve roots, and that can cause symptoms right there. Okay, what causes lack of blood flow? You know, atherosclerosis in the abdominal aorta. The abdominal aorta runs vertically right in front of the spine, and when you plug up the posterior wall of the abdominal aorta with atherosclerosis, it'll plug up the opening, the ostium of the lumbar arteries, and that'll cause hypoxia of the spine. And, you know, what causes atherosclerosis? High-fat diets, hypertension, diabetes, those cause atherosclerosis. Also, all this amyloid clotting, all this leaky gut stuff, iron overload stuff causing amyloid-type clotting in the blood, that'll plug up the lumbar arteries, little branches. In the same patients, they have all the same disease. They get the Western abdomen. They get fireballs in the Eucharist, which is a funny way of saying fibroids in the uterus. They get abdominal aorta aneurysms. They get hiatal hernias and esophageal reflux, gastroesophageal reflux disease. They get sigmoid colon diverticulosis, gallstones in the gallbladder. It's the accoutrement that goes with florid atherosclerosis. I call it the Western abdomen. I'm the one that gave it that name, the Western abdomen, because I see it on almost every single CT scan in a middle-aged and older patient. Okay, atherosclerotic plaque tends to accumulate along the posterior wall of the aorta. Okay, I'm going to get to a picture pretty soon. All right, let's get to the picture because everything will make a lot more sense. And why are the discs so sensitive to a lack of blood flow? Because they don't get much blood flow even under optimal conditions. Let me show you the picture because that's the easiest way to make sense of all this. So here's the abdominal aorta running anterior to the lumbar spine. Okay, this is the sacrum denoted by S, lumbar denoted by L. So your lower back is your lumbar spine. It's got 5 vertebrae. So we name them 5, 4, 3, 2, 1. Okay, and then here's the sacral vertebra. Sacrum doesn't matter. Nothing ever happens in the sacrum. It's very rare. There's some things that can happen, but they're all super rare. Whereas the lumbar spine is a hot spot for pathology. Okay, so the lumbar artery runs mid-height of the vertebral body. Then it drops a small branch, a little twig, to the end plate. The top and the bottom of the vertebra is called the upper end plate, lower end plate. And then by diffusion, a little bit of glucose can get to the disc, and the disc can extrude its waste products. So if you got atherosclerosis in the abdominal aorta, especially accumulates on the posterior wall, you will narrow, which means to stenose or occlude this lumbar artery, and then that drops the blood supply to the spine, the perfusion of the spine, and then that can lead to an ischemic disc, okay? And I'll later on talk about how there's a bunch of chemicals that can damage the ligament. Anterior longitudinal ligament runs right in front of the spine. Posterior longitudinal ligament runs right behind the spine. Okay, so and if you add to that, you're eating a high-fat diet, you have hypertension, you have diabetes, you've got amyloid microclots from leaky gut or iron overloaded. All of that's going to drop the perfusion of the disc, and then it's going to dry out, it's going to crack, and it's going to herniate, it's going to lose its height. All of these things are going to happen. Okay. All right, so we're going to just call it there for tonight, and then the next time we come back, I'll start going through a little more nuance about what's happening in the disc. And once I've explained all this stuff, then I'll go back through the more detailed description of the things you can do to help yourself to minimize back pain, to minimize any type of pain.